their crisis now, and they're going to have to answer for it. Senator Klobuchar.
All right. Thank you very much, Senator Schumer. And this is it. 13 times, not their lucky number. 13 times they rejected this. 13 times with the American people. So when that farmer, soybean farmer in Minnesota, says to me he sees nothing but a perfect storm of ugly because of the tariffs, because of the input costs for his farm equipment, and because of his health care premiums, I'm going to tell them 13 times we tried to do this. You have already seen how the public feels about this, whether it is the Virginia and the New Jersey governor's races, whether it is the statewide Georgia races, including a recent legislative race there. They said enough. They want us to be working together to do something about their health care. And we have given them the opportunity so many times. The straight extension. And we would like to do a lot more, believe me. Reverse the cuts from the big, beautiful betrayal of the bill when it comes to Medicaid. Do something more on my legislation for negotiation of prescription drugs so we could do that faster. Public option, you name it. There's a lot of choices here. But right now, we have an immediate crisis. And as Senator Schumer pointed out, this is not a January thing. It's going to be set by then. This is not a February thing. This is a now thing. And they not only rejected this 3 years, despite 4 of them, including a very conservative Republican voting with us today, they also rejected a 2-year. They also rejected a very clear vote on a simple 1-year extension that basically would have been the same amount of money as they sent to Argentina. So I don't know how they explain to that soybean farmer in Minnesota that it was more important for them to send money to Argentina for one of the president's buddies than it is to help people with their health care. 75% of the people on these plans are in red states. They're in states that Donald Trump won. So I am not surprised that 4 of our colleagues voted with us. What I'm surprised by is that we didn't get that extra 9 that we needed, who behind closed doors, or as you've heard talk in the House, know that we have to do something about this right away. Senator Schumer and I have heard from so many people in our states and throughout the country. Here's one we just heard from yesterday, Virginia. Aaron and his wife, cancer survivor, are going to see their premiums double. That means they're going to have to make some hard choices. Do they pay the high premiums so Aaron's wife can continue her cancer screenings, or do they get some kind of junk plan so that maybe if there's a catastrophe it gets paid for, but the ongoing help is not there? Becky was in a wheelchair who's making progress, and they predict she's going to be out of that wheelchair if she can finish her treatment and physical therapy, but she doesn't think she can afford the premiums. Throughout the country, the people have spoken out. And one state where this is key, when you look at the states that use the most of these plans, it is Texas, it is Florida, and it is the state of Georgia. And just by coincidence, we have the great senator from the state of Georgia, Raphael Warnock, joining us today.
A happy coincidence.
Thank you so much, Senator Klobuchar and